Welcome to Dr. Tom Talks. Today, my first ever virtual Dr. Tom Talk. With the help of the biodigital human, I'm going to be talking about transcatheter aortic valve replacement, or TAVR for short. Here's your heart, and in particular, there's a valve right here called the aortic valve. It separates the left ventricle, the big pumping chamber of the heart, from the aorta, and you can see that blood being pumped out to the rest of your body. The problem is that some people, as they get older, you can get these calcifications around the aortic valve, which narrows it, makes it stiffer and very narrow. So I'm just going to pause this right here and just show you the paint on top of it and just show you how wide it should open. So it should really open all the way around to what's called your valve annulus. But if you have aortic stenosis, it may only open sort of this amount. And that's why you get limited blood supply to your body. So you might feel fatigue, you might feel shortness of breath, and so on, maybe even some chest pain. But the other reason why people, which is much rarer, may need aortic valve replacement is something called a bicuspid aortic valve. So typically you can see here you have 3 valve leaflets, a bit like a Mercedes sign. A bicuspid aortic valve is where you have 2 valve leaflets. 1, 2, so 1, 2, and that might be another reason. So what's the procedure? Well, originally, if you wanted to have your aortic valve replaced or repaired, you would have to open up the chest, but this is a much less invasive procedure. It's called transcatheter aortic valve replacement. And here you can see, I'm going to zoom in right there is your femoral artery, and you can thread a catheter, if I play this again, thread a catheter through the femoral artery all the way up. If I zoom out, it goes all the way up to the heart. And you'll see in the next chapter, this catheter has a valve which is expanded and put in place of your aortic valve. So I'm just going to go back into the whiteboard and show you a couple of things. So this right here is your old damaged aortic valve. And this right here, that's the new valve, which obviously half of the heart here has been cut away, but it goes where the old valve used to be. And so if I zoom back here and I show you the next chapter, you'll see that this replaces or pushes to the side your aortic valve. And if you pause it, you'll be able to see that it opens much more widely. You see there, it goes all the way to the edge, to the annulus of this valve. And that enables you to get the blood that you need restored to the rest of your body. That is transcatheter aortic valve replacement, or TAVR. And this is Dr. Tom Talks.